Welcome to the No Scrubs podcast. My name is Grace. I'm a second year veterinary student, and today I am joined with pre-veterinary student Yoselin Martinez. Today, the topic that we're going to be talking about is transitioning from human medicine into veterinary medicine. Stay tuned. Woo!
Hey
So
Grace, thank you for
Yoselin and
inviting me.
I, of course, Yoselin and I met through the acceptance lab. She's a student that I'm working with this cycle, and I thought that she would be the perfect pre-vet student to host on the podcast. As our first pre-vet, we're going to be talking about all kinds of things from pivoting from human medicine to veterinary medicine. But first off, Yoselin, please introduce yourself and tell us a little bit more about you.
Hey everyone. I'm Yoselin Martinez, Yos for short. Right now, I'm undergoing quite a big journey in my life that I did not expect. Just a little background about me. I come from a family heritage from Mexico, so I do have a Mexican background. I was raised by my parents who are Mexican immigrants, came here for, the American dream, better life, and here we are. From adolescence, from childhood, really, I always knew that I wanted to do medicine my whole life. I just had this, idea or this dream from my mom, influenced by my mom, because back in her home country, she couldn't really pursue any education, just the barriers that existed at the time. So she always said, I would really like for you, pursue something in medicine, like something. Come fast forward to high school. High school comes up, and I was given this very unique and special opportunity where I was told, hey, there's this nursing program that we're offering for high school students. Do you want to participate? And I said, yeah. So I went ahead and signed up, got an acceptance letter, and I said, all right, let's do this. So that was my introduction to human medicine. I was very fortunate to go through the struggles and the late nights of nursing school, as nursing people might know. And at the age of 18, when I graduated with my high school diploma, I also graduated my nursing license.
That's so
So,
cool and very unique to have that opportunity to really pursue
yeah.
medicine so young, especially, given your family's history of really, wanting you to excel and pursue education. It's really inspiring that you were
Yeah.
able to have that experience of graduating from high school and simultaneously graduating from nursing school.
Yeah, I mean, it was quite a journey, Grace. Oh my gosh. It was wow, like having to deal with becoming a teenager and then having to become an adult like overnight
Oh,
because,
yeah.
the next step you got to take your NCLEX and then after your NCLEX get your first nursing job and you just learn
That's a
as you
lot of
go. And so,
responsibility. That's a lot of
yeah, and
responsibility for someone who's 18, 19 years old, maybe even younger, stepping into like a full-time nursing position or any experience really in medicine like that, where now you have patients in your hands. You just, as you said, went from adolescence into being an adult, and now you have to care for patients.
yeah, I mean, it's crazy now I think about it. I'm like, they really let us like go to clinicals, but they did. I mean, we were very, my group at least was a very responsible and pretty mature for our age for the most part. I mean, it
Yeah.
was great. It was fantastic. And I just got to grow up in a environment I was just very lucky with that opportunity, honestly. And yeah, I mean, it wasn't all linear though. I did not successfully pass my first NCLEX attempt. So, but that did not hold me back. I was like, okay, now I know what it's going to be like. Now I know how to get ready and do it again. So I took it again, and there you go. I got my LPN license. I'm a full nurse now at 19. And then the next challenge was COVID hits. This
Naturally.
was in the year 2020. I had just got my nursing license in February. So this was like way beginning of COVID.
Wow.
And yeah. And so at this point, I'm already in it. We just got to go with it.
Yeah.
And
Full steam
I got
ahead.
my exactly. There was no holding back. And so I got my first nursing job at an urgent care. I I was very lucky to get the opportunity to, start working at a very young age of 19. And my nursing manager, this is Rosie, by the way, everyone. She just want to say hi.
Welcome to the pod.
Very loving. No, she gave me this opportunity. Her name is Jonna. She was one of my early mentors of human medicine. She got me through the entire process of becoming a nurse and being very knowledgeable and trained. Like I didn't know anything, Grace. Like that assumption that like nurses know what they're doing right out of high school, graduation. Sorry. No, like you learn as you go. Like the academics, the numbers, you know what you're supposed to do protocol, but there's a difference between in the textbooks and then real life. So
100%. Yeah.
she
As
led
in
me
so
through that
many
entire
careers.
journey.
Yeah, as in so many
Yeah.
careers, like you need that mentorship, you need that support outside of your academic experience. I mean, same goes for vet med, same goes for doctors, human doctors, lawyers, you need that kind of support to help guide you through the true like clinical real life situations. No one's going to get out of school and know everything. That's why medicine is a lifelong career of learning. It's you're
Yes.
practicing medicine every day. You're not solidified and know everything in medicine every day. So I think that that's really
Yeah.
important, especially for you having that mentorship out of nursing school. It sounds like it was the perfect opportunity for you in that time of your life.
Absolutely. Yeah. And just navigating through COVID. And as you can imagine, COVID for everyone in the world was a huge struggle and a challenge because I'm learning to be a nurse with also this new information. And we were all learning as we were going. I mean, it was just a huge challenge. And as you can imagine, the long hours, the huge census that we would see every day at an urgent care. And then people who don't know what they're doing as far as like there's always new protocols because we're learning as we go, right?
Yeah.
During COVID. So it was a very challenging moment in my life, truthfully. And like I said, I had to grow up very quickly because
I
a
like
lot of tragedies and a lot of, downsides. But human medicine, honestly, is the reason why I got into vet med. Like if it wasn't for human medicine, I would have never had, been given the door towards vet med.
yeah.
And so that's where the next part of my journey goes, where, the burnout, I needed to do something different with my life. So I decided to do travel nursing. And it was just on a whim, on a random night. I just said, I'm just going to do it. I'm just going to apply to all these applications. We'll see which one wants to take me. We'll see how it goes. And of course, nothing is ever linear. Rejection. Like, okay, let me do another round. And then eventually got a contract at Blacksburg, Virginia. And that's where my travel nursing endeavors began. And it was just a whole new chapter in my life that introduced me to vet med. And in that community, as people might know, there's Virginia Tech, and it's a whole like community of like academia people who are into agriculture. It's a huge melting pot of like a lot of culture and a lot of people, and it's just you just meet awesome people, and everyone's so welcoming and so nice. It was a great community, and I love it so much, and I miss it dearly. But I met a fellow professor who teaches at a local community college, and she was my neighbor at one point, and she invited me over to her house one day. Said, "Hey, Yas, you want to meet my animals?" And I said, "Sure, why not? Let's see how it goes." I was like, let's see, we'll try it out. We'll give it a go.
Yeah.
And so I went to her house, and she has like ferrets, rats, reptiles, you name it. Like she has almost everything you can think of in her home.
Oh yeah.
And it was amazing, like getting to hold the snakes, getting to play with the rats, getting to interact with all these animals. And I'm like, oh my gosh, like this is so fun. And I think she saw like the awness and the passion that I had at that time that I didn't even realize yet.
Yeah.
She was like, listen, I'm hosting this animal petting zoo at this marathon nearby. Would you like to come and volunteer? And I'm like, sure, why not? And so I go there, and I'm engaging with the community. I'm educating them about the animals, what she's told me about. And that's when I realized I really like this.
Yeah.
And there was a day, I can't remember like if it was before or after, but I know there was a time where she looked at me and she goes, Yas, have you ever considered animals? Like as far as like endeavors? And I'm like, no, actually, no, I did not.
Yep.
And she was like, well, I see you happy, and I'm just gonna leave it at that. But you ever considered that? I'm like, no. And here we go. And ever since that, I realized I love this so much. I want to pursue this as a career.
That's sometimes people's like pivotal moment. Some people dream of being a veterinarian since they're a kid, and other people are in human medicine or another form of career. And then all of a sudden there's just one catalyst in your eyes. It's like all the light bulbs go off. Ding, 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 ding. This is my calling. Like this is what I'm meant to do. And that's just how some pre-vets find it. That's just how it happens.
Yeah, that was exactly it for me because I never thought of it. I mean, I was like human medicine, that was my destination always. Like I was going to go to RN school or medical school. Like that was going to be my journey. But for some reason, I just could never pursue it. For some reason, there was something missing, like a little gap or something. Like, I don't know. Again, not to say that human medicine was it was a privilege and it was a blessing because it led me to this part of my life that I'm
100%.
really enjoying.
Yeah, it was exactly as you said. Same experience for me. Like, I was also pre-med and I was considering going down that path. And same thing, I just was kind of hitting a wall. I love this, but there just feels like there's something missing. I love this, but I don't know if I could do this every day for the rest of my life. I love this right now, but will I love this in 20, 30, 40 years? I love this, but I only love one specialty or two specialties. I really wanted to become an orthopedic surgeon or work in sports medicine because I was a student athlete. And if I thought about myself being like a urologist, or if I thought about myself being a dermatologist, I didn't fit. And I said, what if it didn't work out? What if that one path didn't work out? And all of a sudden I find myself in Kenya. I'm working hands-on and doing animal biology work in the field right now. And I was having a conversation with a trusted professor studying for the MCAT. And he said, do you think that you would want to possibly pursue veterinary school instead of medical school? And it was as if I had never heard of a veterinarian before. Like I had never thought of the field of veterinary medicine. I had never considered pursuing veterinary medicine. It was genuinely as if I had never heard of the profession of veterinary medicine before. I had never heard of a veterinarian. I have dogs. I have my own animals. We bring them to the veterinarian a
Yeah,
couple times a year. Of course, I know what veterinarians are, but it just had never
yeah,
clicked for me until that moment. All of the pieces aligned. And as
yeah.
you said, that was your catalyst moment. This was my catalyst moment. All that you need is one person to believe in you and help ignite that spark to really pivot your path from wherever you are into veterinary medicine, which I think is really unique.
Wow, that's awesome that you had that story in Kenya. Like, how did you come to the opportunity? Like, I'm just curious. Like, how
Yeah,
did
it
it
was
all like align?
Yeah, it was a study abroad opportunity actually. And same thing, COVID hit. I was a sophomore in college and COVID hit. Went home. My entire junior year, I was home. We didn't have any in-person classes. And we have a study abroad experience usually for juniors through my undergraduate institution. And since juniors
Mhm.
were ineligible to go, they opened the opportunity up for seniors. And I would have never had this opportunity if it weren't for COVID. Literally, COVID made everything work
Oh my
out because
gosh.
I was a student athlete. I had to be on campus all year round. So there was no
Yeah.
opportunity for me to study abroad. My coaches would have never let me study abroad. But all of a sudden, I'm a senior.
Oh my
I finished my fall
gosh.
season and I have nothing to do in the spring. Now is my perfect
Yeah.
opportunity to study abroad. I went out to Kenya. I was there for 8 weeks and took two
Yeah.
courses out there. It was all fieldwork based. I was interacting with
Hmm.
animals. We were doing behavioral work. It was the perfect catalyst. No better opportunity than being in Kenya with
Wow.
wildlife and deciding, you know what, I think I'm going to pursue veterinary medicine instead of human medicine.
Do you feel like there were any like subtle, like, I guess, clues that you were going to pursue this at some point? Like you mentioned, like wildlife and skit.
Yeah,
Like,
of
was
course.
there
I
anything
love
else?
wildlife. I was a marine biologist by trade as like a 5-year-old. That was what I said that I wanted to do. I
Gosh.
would always go snorkeling. I got my scuba diving license young.
Oh
I
my
loved going to
gosh,
the
that's
zoo.
awesome.
I mean, there was a lot of,
Mhm.
subtle things that animals would always stand out. I had very strong human animal bonds with all of my pets. I'm an only child, so I really had like a very strong connection with all of the dogs that I was raised with. But yeah, I don't think that I saw it. I don't think that I saw that veterinary medicine was for me until the perfect time. And I truly believe that
Yeah.
everyone will find their path when they're ready and they'll find their path when they need to. Whether
Yeah.
that's when you're 5 years old, 15 years old, when you're a freshman in college, or when you're 40. I mean, there's people who go to veterinary school who are in their 30s, 40s, 50s. So I think that it's a really
Yeah.
unique career that as long as you put your mind to it, you can truly accomplish anything in veterinary medicine and you can go to veterinary school late.
Absolutely. I feel like I realize it more being older. Like, I appreciate it a lot more. You know what I mean? Like, if I was back in my 18-year-old self, that, pursuing my undergrad at a university or community college, I would have not had the same, like, discipline and motivation because I'm an 18-year-old. I didn't know what I was doing at the time. And, I feel like being older now and knowing, what I want, I
Yeah,
appreciate a lot more. And I want to like nurture it. You know what I mean? And
absolutely.
really pursue it. I just feel like it's a whole blessing um, to be able to do this. Really, truly, like it's honestly a huge blessing. And if it wasn't for this path, human medicine, I would have not made it to this point. So thanks, COVID, in a
Yeah,
way.
thanks COVID. Yeah,
Yeah,
thanks COVID for
yeah,
me too. Yeah, thank you,
yes,
COVID.
yeah.
So you've talked about your transition from nursing into veterinary medicine. How does that look like for you, academically speaking, going back and having to retake prerequisites, as someone who's in their 20s now, a non-traditional student? What does that look like for you? And can you provide a little bit more insight for other students who might be in similar shoes to yours of how they might
Yeah.
transition into veterinary medicine as a non-traditional student?
So for me, I had to start from zero, 0.0. I did not have any requirements for any general education or any Gordon rule, like nothing. I
Yeah,
was just kind of, in a way, if you want to say, grandfathered into the nursing profession because I had this unique opportunity.
right.
So I started from zero. So everyone, if that is discouraging you, please don't let it. It's absolutely possible. Absolutely. Honestly, the key is just to ask questions. You just ask questions, ask people. You can do your online searching, of course, and meet with your local, advisor at the college you're thinking of going to. And it's absolutely possible you can, get it done. So I work as a wound care nurse, and when I'm off, I pursue, the vet med, world. So I feel like I'm living two different lives, like the human
Yeah,
medicine life and then the vet med life. Like when I'm not wearing my nursing uniform, my thick scrubs, I'm wearing my other pair of scrubs for vet med.
yeah.
And I'm volunteering, I'm doing schoolwork, I'm studying. I'm also doing TNBRs, I'm doing other shelter work, like you name it. There's always something on my schedule. So if I ever say I'm busy, I am not lying. Please look at my
Yeah,
Google
I believe
Calendar.
it.
Yeah, it's like there's always something going on. But yes, there are nights where I had the all nighters. Like tonight, I'll probably pull all nighter.
Oh
So
no.
if you see me drinking my coffee, this is why. Um, so it's all part of the journey, but it's so worth it. It's so worth it because you're doing something that you want to do. You know what I mean? Like the
Yeah.
passion, and it's absolutely worth it. Yeah. There will be the struggles, but you can do it. It's absolutely possible, of
I can only
course.
imagine
Yeah.
how difficult it is, but that's just to say that no matter where you are in your life, no matter what position you're in, if you have a
Mhm.
passion, whether it's veterinary medicine or something else, pursue it. Find the
Yeah.
time. There is always time to pursue a passion, and you can
Mhm.
always make it work. I mean, Jocelyn's
Yeah.
talking about working, full time as a nurse and doing school and vet med work on the side just to be able to continue to fuel that passion and eventually pursue veterinary school, which is incredibly inspiring. I mean, a lot of students have to manage work opportunities, have to manage, employment to be able to fund school as well. And so there's a lot of barriers that people have to face in order to pursue their passion. But as I said before, and I continue to allude to, if you have a passion, follow it. Try to find the means. Talk to someone, talk to a friend, talk to family, talk to a trusted advisor, as Jocelyn said, to find a way to make it work. If you love something, you might as well give it a try and go all in.
But I did want to ask you though, like, was it like challenging for you to like transition from like your courses you had already taken for medical school into veterinary medicine? Like, how was it for you,
Yeah, so
school wise?
I'd completed all of my general biology coursework, my chemistry series, my physics series. Thankfully, that was required for my undergraduate major. I was a biology major, and it was also required for pre-med. So at least I had those courses out of the way, but I did have to consciously take a gap year to finish the remainder of my prerequisites. Otherwise, I would not have been a competitive applicant. I needed to really sit down, hunker down,
Mhm.
finish my animal science coursework, my animal nutrition coursework, take a public speaking class. I needed to make a conscious decision after being pre-med into
Yeah.
pre-vet, just because there is some overlap, but the overlap is not overwhelming. A lot of people have misconceptions about, the difficulty of entering veterinary medicine, the prerequisites required for veterinary medicine, the competitiveness
Yeah.
of veterinary school admissions. But we're here to say, it's quite competitive and it's very difficult, very rigorous. I completed all of my medical school prerequisites, and I still didn't have enough prerequisites to apply to veterinary school. I was
Oh my
still missing
gosh.
prerequisites. So
Wow, no way.
I finished all of my series at Princeton and was, ready to apply to med school. The only one course I had to take was biochemistry, and I was going to take that the summer after graduating. But yeah,
Uh-huh.
for vet school, I had so many more prerequisites that I had to take just because they're looking
Mhm.
for different coursework. They want to see that commitment to
Yeah.
animal science. They want to make sure that you have a better understanding of anatomy and physiology before you get into vet school. Animal nutrition is
Yeah.
another big course. And of course, communication in veterinary medicine is huge. So public
Mhm.
speaking is ironically a course that they require for veterinary medicine, as opposed to human medicine. They don't require any public
Isn't
speaking
that interesting?
prerequisite.
Oh my
Isn't that
gosh.
interesting?
Yeah.
Yeah. I mean, I guess that you need to know how to communicate with humans and animals. So it is critical
Yeah.
to be able to communicate in the field of vet med. But yeah,
Mhm.
for me, the courses between vet med and pre med were very different. And I was definitely a deer in the headlights for the first couple of weeks when I made my transition from pre med to pre vet, trying to figure out, okay, where do I go? What do I do? What do I have to do? What
Yeah.
boxes do I have to check off? And I had no support. I didn't
Oh my
have any
gosh.
pre-vet advisors. I didn't have any trusted friends or family who went through the veterinary school process.
Yeah.
I met one individual who let me shadow them, and she was phenomenal, but she was in her
Mhm.
50s or 60s. And so she was so far removed from the vet school admissions process that she didn't really know how to help me through that
Yeah.
through that opportunity. So I did it completely blindly. I did it completely on my own, which is why I ended up starting the acceptance lab so that
Mhm.
I could engage with more students who were in my shoes. I felt so
Yeah.
bad hearing similar experiences to mine. Thankfully, I prevailed. I made it through my vet school application process. I got multiple acceptances and matriculated to UGA, but there are so many students that don't have that support and they're just in the dark for their 8 month long application process. And feeling alone for 8 months is not a good feeling. So
No,
I
no,
wanted to make sure that other students feel support and that they have an outlet to turn to. And so that's kind of why I started the acceptance lab in the first place, just based off of my pivot from pre-med to pre-vet.
first off, thank you. Like you've been helping me and so many other people. Like I was completely lost until I met you. And like you gave me like this roadmap pretty much. Like you think of the Google apps, that's you. Like you're just giving me every single like turn and route and exit, like what I should do. And okay, this is not sponsored, everyone. Okay. No, no, Grace is honestly like my savior and so many other people's saviors. Like you have made like the work that you're doing seriously has honestly made such a positive impact
Well,
in
thank
all
you.
of our vet school, grad school, journeys. So thank you so much for doing this, really.
Of course, that's really what makes me the happiest is like hearing the success stories of students and being able to make an impact in higher education. It can be difficult, it can be daunting to navigate higher education. And so
Yeah.
I just never wanted students to feel like there was a threshold of where they could reach or that there were limitations based off of navigating an
Mhm.
application portal or completing a personal statement. You know, students should not be held back by these small little things. And so that's kind of
Yeah.
why I started to do what I do, and hearing people's impact statements and hearing that the acceptance lab is able to contribute positively to people's processes makes me feel so good.
Yeah.
Thank you for the compliment.
Yes. Again,
I appreciate
my
it.
two dogs are applauding for you too. Okay. That's why they're here.
So Yaslin, what would you say your biggest challenge was pivoting from human medicine to veterinary medicine thus far, at least?
When I made my announcement of like publicly, if you want to say, to the people that I know in my life that I was pursuing vet med, the first question was, why would you do that? Of course, the topic of income came along, and it was always, why would you do that? Just go to medical school or just go to RN school. Like, why would you do this to yourself? So, as you may be familiar with Grace, there's a, kind of a little stigma or a stereotype, if you want to call that, of vet med. You're just playing with animals. So you're not really doing much. There's always that little, like, in a way, it feels like you're being degraded for what you're doing and what you know.
Veterinarians aren't
Because,
real doctors.
oh my gosh, I'm
Veterinarians
so big on
veterinarians
veterinarians
aren't
are
real
doctors.
veterinarians aren't real doctors. Veterinarians, all that they do is play with puppies and kittens.
Yes.
Veterinarians are just dentists for dogs. Oh, I've
Yep.
heard it all. Oh, yes.
Yes.
I
Yeah.
understand exactly what you're saying of the stigma of veterinarians. Or here's one of my favorites. How long is vet school? Is that 1 year or 2 years?
Yep. Same. Yep.
Yeah.
And you're just kind of
Veterinarians
sitting there.
Yeah.
Yeah.
Veterinarians actually work on multiple species. Veterinarians work
hmm
across different organ systems. Veterinarians
hmm
are neurologists just as much as they are cardiologists, just as much as
Yep.
they are oncologists and dermatologists.
Yes.
Veterinarians have to work on every body system and have to be familiar with every species. And the veterinary licensing exam is comprehensive. You will be tested
hmm
on birds, sheep, goats, fish, cows, horses, exotic species, deer. I knew students who got tested on deer on the NAVLE this year. There is a
Like,
wide variety that you have to know as a veterinarian. Continue,
yes.
Dylan.
No. Thank you, Grace, for saying that. You said it so perfectly. Thank you. Yes. No. So, when I went to the clinics to shadow, or whenever I encounter people in vet med, they would find out that I'm from human medicine. And it feels to me the challenge is like feeling like I don't belong here because of all this negative, feedback that I'm getting from people. But at the end of the day, I got to get myself out of that bubble and say, yes, you do belong here. There's a reason why you're here. There's a reason why you got this opportunity. Don't listen to them. This is your path. So just keep going for it. Keep doing it. Do you?
100%.
So
I'm so sorry that you've had such a disheartening experience thus far of people, saying, why are you leaving human med? Why are you entering veterinary medicine? It definitely does feel disrespectful and degrading to the veterinary profession, as if, the veterinary profession isn't fulfilling and the veterinary profession isn't saving lives and the veterinary profession isn't doing all of these amazing things to make an impact on the lives of not only animals, but humans as well. A big part
yeah,
of veterinary medicine is not only animal welfare, but the human animal bond. I think that the misconception of veterinary medicine runs really deep, not just about the day to day of a dog and cat veterinarian, hypothetically, but just like the misconception of the field in general is very disappointing in the public. But that's kind of our goal, right? Like our goal is
yeah,
vets, our goal is veterinary students, our goal as veterinarians is to continue to educate those around us, including the public. So I'm really
yeah.
sorry to hear that there have been people that are, ragging on your parade or not supporting you throughout your journey fully. Would you say that it's more the people on the medicine side or more the people on the vet med side, or kind of a combination of both that have been giving you pushback on your career change?
Truthfully, it's been both. In the
Mm.
beginning, it was for sure the human medicine side was very dominant, like saying, why would you do that? Why would you do that? And then vet med as well. But I feel like now that I'm like kind of like becoming more like familiar with the teams and like with vet med and stuff, like they realize like, no, she's not here to disrespect. Like she's here because she actually wants to be here and she wants to learn from us.
What would you say to students who might be in your shoes now, who are thinking of pivoting from human medicine into a career in veterinary medicine, whether they're in high school, college, or a career changer like yourself? What word of advice might you give to someone who is considering changing from human medicine to veterinary medicine?
Do it. Just do it. Just there's a reason why you have that calling in your mind. If it keeps you up at night, if you keep thinking about it on the drive to Starbucks or to Chick-fil-A, wherever you're going, there's a reason why. So just pursue it. And even if you are unsure about it, go shadow someone. All it takes is just one yes for a veterinarian office to say, yes, come on in. And then you will get the clarification, whether you want to do this or not. So just give it a go. The worst case scenario that can happen is that, hey, I don't want to do this. And then you move on with your life and keep enjoying it. You know what I
So
mean?
true.
So
Yeah.
yes, go for it.
There's no risk, really. If you're considering that change, as Jocelyn said, worst case you
Yeah.
say is, never mind, let me find something else. There's no,
Yeah.
I think people's fear like holds them back, fear of change, fear of having to maybe do more prerequisites or continue education. But veterinary medicine
Yeah.
truly is such a fulfilling career in any regard, whether you're a
Yeah.
vet assistant, a vet tech, a kennel tech, a veterinarian. There are so many
Mm.
spaces in veterinary medicine that you can step into. And even within being a
Yeah.
veterinarian yourself, public health, food animal
Yeah.
veterinarians, mixed animal veterinarian, ambulatory medicine. You can go into a specialty and do cardio or neurology, dermatology,
So many
oncology,
options.
so many
Yeah.
options as a veterinarian. Once you pass the NAVLE, you can become board certified, you can gain certifications, you can try different things, have different experiences. The amazing thing about veterinary medicine is you are never just one thing.
How was it for you, like when you made your pivot, when you like made it public in your personal life?
It was definitely a lot of education and it was a learning curve, I think, for my family and my friends, for them to understand what vet school is, what vet school entails, and all of the work that I had to put in to get to vet school.
Yeah.
Graduating college, you would think that you could matriculate right to veterinary school, and that's not always the case. You need a lot of these prerequisites. You need an abundance of experience hours, animal experience, and experience under the supervision of a veterinarian. So I had to gain all
Yeah.
of that experience and start from scratch. I had thousands of hours in human medicine working in dermatology, in orthopedics, in research, but I had no
Wow.
animal experience. Same
Hmm.
same thing. I kind of had to start from like point zero. So when I shared with my parents, like, hey, I really think I want to pursue veterinary school. I'm really leaning towards vet school over med school. They said, okay, well, what can we do? How can we support you? And I said, I think I have to move home for at least a year and figure it out. And they were just
Yeah.
nothing but supportive, which was really great. It was just a lot of education. They had to
Yeah.
learn it with me. They had to learn, why do I have to get a full-time job as a vet assistant first? Why do I have to scoop poop? Why am I pet sitting to
Mhm.
gain animal hours? All of those types of
Yeah.
things. Why am I waking up at 5 o'clock in the morning to go to the wildlife center? Well, the birds have to be fed before 7. So those types of things. It
Yes.
was a learning curve
Mhm.
for them and it was a learning curve for me, but I was really grateful that I
Yeah.
had the support that I had. When I told them that I didn't want to become a human doctor, I wanted to become a veterinarian, they didn't
Yeah.
hesitate and they said, perfect, let's do it. How are we going to do
Oh,
it? How are we going to get you there?
that's just amazing. That makes me so happy that, that they were able to support you and say, yes, Grace, go ahead and do it, girl.
Oh,
That's
yeah.
awesome.
I think that now they like to
No.
brag
Yeah.
too. They're like, do you know how competitive it is to get into veterinary school?
So now that you're kind of talking about like your experience of like working in vet med, do you have like a particular story or anything that, has made your experience or I don't know, just want to share any story that's been like impactful in your journey so far in vet med?
Yeah, this past summer, after the first year of my veterinary school curriculum, I kind of left and
Mhm.
I said, I feel like I've learned so much, but I also have learned nothing. Like I felt like I
Mhm.
was leaving vet school with so much knowledge, but I knew everything that I didn't know, if that makes sense. And so I was like, oh my gosh,
Mhm.
there's still so much to learn. I don't know how I'm going to learn this in another 3 years and then become a practicing veterinarian. And then I went to my externship in my hometown. I went home, worked for 2 weeks, and every single day I was making correct problem lists, correct differential diagnoses lists. I was reading
Yeah.
radiographs, like things were coming to fruition. And I was like, wow, I've really learned so much more than I thought. And so I wouldn't say that it was like
God.
one specific case that summer. Well, there is one that I definitely think of, but
Mhm.
it wasn't just like one specific thing. It was just really seeing my education and my clinical experience combine and making me feel so
Yeah.
comfortable in the field. And like, wow, I know that I can become a great veterinarian. Yeah, so this one case came in and it was a 4-week-old kitten, just itching, scratching. Dermatitis was so itchy and scratchy that it almost became lethargic, wasn't eating. Just the cat was not doing well at all. And we were asking for the history. This is a 4-week-old kitten. Where did you find it? They had found it in some wooded area behind their home, abandoned. They just brought this cat in. They had it for about a week. So we're like, is it ringworm? Is it this? Is it that? And the veterinarian turned to me in front of these clients and they said, Grace, if you had to pick one thing that you think it is, what is your top differential diagnosis? And I'm like, oh my gosh, I'm just a
Oh,
first year.
wow.
What do I think? And she said, I want you to be the veterinarian right now. What do you think this cat has? And I looked her dead in the eye and I said, sarcoptic mange. And she said, I don't think so.
Oh my
And I said,
gosh.
oh no, oh no. And she said, but why? Like, defend your answer. And so I defended my
Yeah,
answer
yeah.
and I said, it's just the presentation. There's just something about it. I feel like it's sarcoptic mange. What's really
Mhm.
triggering me is all of the wildlife that we have in Florida. they found this cat in a wooded area. I feel like it's probably interacted with wildlife, sarcoptic mange or scabies. It fits. She said, all right, go
Yeah.
run the tests. I do a skin scrape.
Yeah.
Sarcoptic mange, sarcoptic
No way.
mange.
You
I was
did
right.
it?
I was right.
Yes. Oh my
And
gosh.
it wasn't that, she thought that I was wrong necessarily, but she just thought, think about the case presentation, sarcoptic mange is
Yeah.
really rare. And she said, in her 30 years or 20 years of being a veterinarian, she said, I've never seen a case of sarcoptic mange in a cat. What made you think that it was sarcoptic mange over ringworm? The lesions just did not look as much like ringworm as I thought. It looked like a different type of lesion. And I had
Yeah.
just learned about sarcoptic mange like a few weeks before externing at this vet clinic. And it
Yeah.
just kind of pieced everything together that I was like, it's the presentation, it's textbook, it looks exactly like it did in my
Oh my
slides in
God.
vet school. I want to do the skin
Wow.
scrape, but my differential diagnosis right now is either ringworm or sarcoptic mange. I'm really leaning towards sarcoptic mange. It's just like the perfect moment where everything came into fruition, where I was like, wow, I'm using my deduction skills, I'm using my clinical skills, I'm using my academics, and I'm using a patient's history and putting it all together and forming a differential diagnosis like a real doctor. And I'm just a first year. It made me just feel really proud. And especially in the education that I was receiving, I was like, wow, I've learned so much more than I feel like I did. You leave and you're like, oh my gosh, how am I ever going to pass my boards? How am I ever going to do this? I feel like I don't
Yeah.
know anything, but I felt like in that moment, I felt like a baby doctor. And as a veterinary student, you can participate in these externships where you do play baby doctor. Like that is basically what you are. You get to go into these
Yeah.
places, whether it be a corporate or a non-corporate veterinary clinic, and if
Hmm.
it's a GP or whatnot, but you go into this veterinary clinic and you are baby doctor. Like the
Yeah.
veterinarian was awesome, and under her supervision, she was like, conduct a full physical exam. Okay.
Wow.
Conduct a full orthopedic exam. Probing me with questions
That's
like
amazing.
grade the tartar, grade the murmur, those types of things
Yeah.
where it's like those are things that you will do day to day as a veterinarian. And I'm a first year gaining these experiences in the clinic through an externship. 110% recommend. Phenomenal
Oh
experience.
gosh, that's so amazing that you have been able to do that. Even like a first year, like that's amazing. You realize how amazing that is? Like, oh
I know
my
it's so much
gosh.
fun to like actually learn things and put them into practice and be able to apply
Yeah.
your knowledge. Like applying your knowledge in those types of settings, like it's really amazing. And I'm excited to go back this summer and see how much more I've even learned. Because in the trenches right now in cardiology, I'm like, I know nothing. I know nothing. And I'm sure that I'm going to go back and I'm going to be like, that is a left basilar diastolic murmur. And they're going to be like, okay, grade the murmur. We don't need to know all of that.
Growing up, it was kind of difficult for us to understand, what our veterinarians were trying to teach us in education, all this and that, because we were just kids, and my parents were dominantly Spanish speaking at the time, and so like I never want to make anyone feel like they're not included in like
Yeah.
in the treatment or like education. So I would love to learn, Spanish and be able to break that barrier if I can. So it's very interesting, hearing you say all that, about like learning as you go. And I'm like, I wonder how that would look like, trying to learn in like two different languages. You know what I mean?
I believe that you wanted to share a little bit more about your experience as a student and representation and overcoming some personal challenges. Do you want to speak a little bit more on that and experiencing disability in medical profession?
Yeah, absolutely. So what people might notice when they meet me, first off, I'm not having a stroke. It is called Bell's palsy, okay? And that is that's okay. I'm okay. No, I say that because since I was a little girl, since I was born, as far as I know, um, I my family noticed that there's a little difference in my, symmetry as far as like facial expressions and like blinking and stuff. And they just couldn't figure out what it was at the time. So a lot of my childhood was being in specialist offices and, getting every single imagery, blood work done, you name it, trying to figure out why is it that I can't, why is it that one side of my face is not as symmetrical as the other? Like I can't smile, like, symmetrically, my blinking, I have dry eye, like there's all these like complications I was having. And it wasn't until a hearing test that they determined that I'm also deaf from this side, from where everything is, where the palsy is at. And so everything kind of came together at that point that there was something wrong. And so again, the question came up, well, how do we fix it? So I've gone through two separate facial reconstruction surgery. I'm trying to recuperate the symmetry. And so when I was like maybe around 10 years old, I went through that procedure. And so believe me, I know what it's like to be like in the hospital and having to go through all those challenges and difficulties. And it was also typical because, I was a kid and kids are honest. Kids will, say things as they are and, but they're kids. They don't know. I didn't know.
Yeah.
And so, of course, there were the challenges of being the odd one out, the different one.
Yeah.
Well, Jocelyn is not here for a week or 2 weeks. So where is she? Oh, Jocelyn came back, but she has all these sutures. Like, what's going on? So I was always the one that was, I feel, was seen as the different one, the one that needed to be sat at front of the classroom to hear good, the one that needed special needs. Like, it was always a challenge. Like, for me, I felt like I always had to like had an extra step to do something because of my disabilities. But it's okay because it's made me a lot more resilient. Like, I don't let anything particularly stop me. I don't let those disabilities prevent me from achieving my dreams. Like, I have a nursing license now. Like, I got through that. I got through human medicine. Like, I didn't get through vet med as well. Like, like that doesn't change anything that I can do. Yeah, I mean, it's been a challenge, but it's also been a blessing in disguise as well. And so, yeah, feel incredibly lucky to, have the opportunities I've had. So, but
Well,
yeah,
I think
no.
that you really speaking to all of your hardships, whether it be experiencing and navigating education as a first generation student, navigating your disability and showcasing that your disability is not a limitation. It's not holding you back from anything, despite what people may think. It's incredibly
Yeah.
inspiring, not only to me, but to a variety of other students who I hope will watch this and see you as an inspiration. So I just want to say thank you so much for sharing about that as well, because representation matters. I hope that students will listen to your advice and will really, take your advice into account as they wonder if they should consider veterinary medicine themselves.
Like, don't let the challenges, bring you down. Like, just keep going at it. She always says, girl, you got this. You can do this. It doesn't matter. You're from human medicine. If you have the passion, just go for it. So I've had incredible people around here in my life and who have literally opened a door for me to say, here, come into our world. We would love to show you. Like, I've been very lucky and incredibly blessed. And like I said, all it takes is just one yes to say, yes, come in and we'll show you, That's all
100%.
it takes.
Yeah, all you need and ask for opportunities. You're never going to be
Yeah.
given an opportunity unless you ask. Usually it doesn't fall into your lap. So if you want to shadow, ask. If you want to become a veterinary assistant, apply for positions. Those types of things you need
Yeah.
to go. If you have a dream, you need to achieve it somehow. If you have a dream, you need to fight for it. You need to do what you need to do. And that's my big piece of advice. If you have a dream,
Yeah.
do everything in your power to pursue that dream.
There's people like us out there. We exist, from human to vet med. We're out there, we understand, and we hear you, and we can do this.
Yeah. If we could do it, you can too.
Absolutely.
All
Well,
right. Well, thank you so much, Jocelyn, for joining the No Scrubs podcast. I really appreciate your time. Yay, Jocelyn!